Hello. Today we will be reviewing advanced nursing roles, in particularly advanced public health nursing.
According to the American Nurses Association, advanced practice registered nurses, whether they are nurse practitioners, clinical nurse specialists, nurse anesthetists, or nurse midwives, play a pivotal role in the future of healthcare. Advanced practice registered nurses are often primary care providers and are at the forefront of providing preventative care to the public.
The American Nurses Association outlined 8 principles of the public health nurse. They are as follows. The client or unit of care is the population. The primary obligation is to achieve the greatest good for the greatest number of people, or the population as a whole. The process used by the public health nurses include working with the clients as an equal partner. Primary prevention is the priority in selecting appropriate activities. The focus is on selecting strategies that create healthy environmental, social, and economic conditions in which populations may thrive. An obligation to actively identify and reach out to all who might benefit from a specific activity or service. Optimal use of available resources to assure the best overall improvement in the health of population is a key element of the practice. Collaboration with a variety of other professionals, populations, organizations, and other stakeholder groups is the most effective way to promote and protect the health of the people. Advanced practice public health nurses can practice in a variety of different settings. These settings include public health departments, schools and universities, parishes and faith-based programs, home care, rural care, primary care clinics, jails and prisons, and even ambulatory outpatient clinics.
To gain a better understanding of how advanced practice registered nursing roles relate to public health, we asked Professor Taha to tell us about her experience. Professor Taha is a faculty member at Cal State San Bernardino, and she is also a clinical nurse specialist as well as a nurse practitioner. What advanced practice nursing role takes priority in your practice?
In my job as a pediatric nurse practitioner, I focus mainly on taking care of patients and their families. So I do direct patient care where I assist patients, I formulate a plan of care, and I work with my attending who's an MD, and basically putting the plan of care together and implementing it with this patient population that I work with. So besides taking care of the patients and the family, I do a lot of education. Some of the education goes to the families directly about certain medication or certain procedures, such as, for example, placement of vagal nerve stimulator to control seizures. And then I do a lot of teaching for the nurses in the hospital. So I get invited to be a speaker quarterly for the NICU core curriculum, the pediatric ICU core curriculum. And whenever we have conferences or symposiums that has to do with pediatric care or pediatric health. Beside that, I do serves in committees for the hospital, policy and procedures. So whenever it comes, whenever times to devise policy and procedure that deal with my patient population, I serve as an expert for the hospital and basically do the assessment and evaluation on those policies and make sure that they match what's in the current literature on that practical area. Beside that, I also participate in research. I help other doctors and nurses conduct research in the medical center. Plus, I have my own research that I conduct with patients.
What is your connection to public health?
So all acute care practitioners, if you are a nurse, if you're a doctor, if you're a nurse practitioner, our goal is to get people out from the hospitals to the homes. Because, of course, the more you stay in the hospitals, the more bad things could happen. You could get influenza, pneumonia, medication errors, etc. So our goal always is to prepare our patient population, children and family, to be able to deal with their conditions out in the public. and basically integrate them back into the community in order to maintain a productivity. So in my case, for example, like, I work with children who have traumatic brain injury. We try to educate the families. We try to educate the children. Like whenever we have a sport injury, like kids should not be riding bicycles with no helmet. Kids, if they have a concussion playing football, they really should not be playing football again for 3 to 6 months, because brain is one time merciful. The second injury, it's going to have an impact for the rest of their life. So this is the way I see my role relate to the public health nursing or to the community, because we try to educate patients, families, and even sometimes practitioners. Like, we have pediatricians or doctors in the community who deal with complex patient populations, and sometimes they don't know how to manage them. So we try to reach out to the public, families, children, and we try to reach out to the pediatricians in the community who provide care for those patients and educate them.
In conclusion, we can see that advanced practice registered nurses work with the public a great deal in their roles.